Now, we're going to talk about monovision with LVC pre-ops. Laser vision correction monovision refers to one eye being corrected for distance and the other eye corrected a little bit for near. Now, the terms monovision and mini monovision are very, very synonymous. Mini monovision meaning just a little bit of reading vision. This is for patients who are above 40 and have entered their presbyopic years. Presbyopic meaning the natural lens of the eye is slowly starting to lose its flexibility, and reading glasses would be necessary for these patients. Now, monovision is a great option to be glasses free or minimize the usage of reading glasses. One eye is corrected for distance, the other eye is corrected for full near or semi-near. Now, to determine which eye would be corrected for distance, which eye would be corrected for near, eye dominance needs to be step number one. Now, when we do your eye dominance test, either with a little triangle, with a little window, or covering a one eye, which you can read better, once the dominant eye is determined, that'll be the one that'll be corrected for the full distance correction behind the phoropter. We use age norms, which are typical, which will get you how much of a plus power to add for the non-dominant eye. So for example, if I use my right eye as my dominant eye, which is what I would use for, let's say, looking through a telescope, a microscope, if my left eye is my non-dominant eye, this is what will be catered for up close. Typically, on average, by the time someone hits about age 45, give or take a couple years, they're going to be at about a plus 150 add. When we reach the ages of about 50, you're probably going to be at about a plus 2 add, give or take a few years. And then when you reach the ages of 55 and above, you're probably going to be at a plus 250 add, give or take, or 55, give or take. Now, for those patients, when you have them behind the phoropter, you just present the distance chart with both eyes being corrected for distance. Depending on their age and age norm, you start clicking in the power behind the phoropter for your near vision. Still have them look at your distance and then present a reading card. You physically can just hold the reading card in front of the phoropter. Now, when you're doing that, you just ask the patient what's the smallest line you can see. The advantages of monovision is that it does allow for the patient to be able to see distance and up close. The one disadvantage or compromise you can say is that, well, it does split the eyes up to a certain amount, reducing depth perception. So the patient just needs to be aware of that. Yes, it'll take some time to adapt to it. However, the big advantages of not needing glasses for a really extended period of their life is a huge plus for those types of patients. Once again, monovision, dominant eye is corrected for distance, non-dominant eye is corrected for reading. With mini monovision, you're probably only going to cut your reading add by about half. So that patient will be able to achieve very good distance vision, pretty good computer vision. Reading, they may need something under dim light conditions.